From a value-based performance perspective, we consistently at Excela Health have been able to be a top performer, but not the top performer. We consistently, or not inconsistently, miss 1 and 2 patients who don't get the evidence, whether it be ACE inhibitors, beta blockers, the proper antibiotics. What Zynx will allow us to do with the CPOE system is to make that more obvious to the clinician, not rely on memory to remember the antibiotics, to remember to order the ACE, but we can prompt them and guide them in writing orders and developing order sets. Zynx will definitely play a factor in meeting meaningful use criteria. One, it allows us to use evidence-based medicine. It allows us, with the implementation of Cerner, which will be new to our organization starting in November, to use evidence-based medicine to drive order sets and to drive physician practice instead of memory or pieces of paper or post-it notes that we frequently leave for physicians, say, did you do, or can you do, or did you remember to do something? This will drive us in that realm.
We have had several boot camps, is what we're calling them, with physician orders building, and they have been very highly successful. Our initial order set retreat days, we had 2 days, December 14th and 15th, 8 inches of snow that morning that came down. So I was literally plowing the snow with my vehicle driving into the complex, and we had 29 order sets on the docket, and a lot of skeptical people out there saying, I think you're overzealous, I don't know that you're going to get through that. We actually ended up with 35 order sets done in 2 days. What we did is I knew that I needed to utilize physician time wisely. So we had 4 rooms running at one time. And in each room I had 2 facilitators, 1 to type and 1 to facilitate, basically. And what we did was we assigned a 2-hour time frame to each physician so they knew when they had to be there and when they were done. We stuck to the time frame. And it was critical for me to have them start with medications, labs, radiology, and consults, because if we ran to the 2-hour time limit, I had what I needed from those physicians so that we could let them go and we could finish up on the back end what we needed to from nursing, respiratory, all of those things. We actually got through every order set and came out with more done because they had gotten through them. And the physicians were the ones that had requested, can we do more? Is there some in there that we can look at? So it really worked out well.
I think what Zynx does, and we looked at many systems similar to Zynx when we selected Zynx, is that Zynx, one, does the research on the back end for us, and it uses multiple sources, not one source for pulling the evidence forward. It allows us to see the universe, but to narrow the universe down to orderable sets that are manageable for practitioners and clinicians to use in the real world, not in the academic world, but in the real world setting. And it also, I think, has allowed us to develop a structure and a process around order set development that has more evidence itself behind it versus just 3 doctors in a room and I think we should do A, B, C, and D in that order.